Hi, I'm Len Richards. I'm the Chief Executive of Cardiff and Vale University Health Board. Today, the 21st of November, is Stop the Pressure Day, a global initiative aiming to reduce the incidences of pressure ulcers across the world. A pressure ulcer, which is also known as a bed sore, is an unfortunate occurrence that can affect any individual at any stage of their lives, but those most at risk are immobile people and wheelchair users, premature babies, the elderly and the chronically ill.
Pressure ulcers are usually caused by sustained pressure and shearing forces, often over bony areas which damage the skin and the soft tissue beneath.
It was reported in 2015 that pressure ulcers accounted for 9% of all wounds in the UK managed by the NHS. After adjustments for comorbidities, the annual cost attributed to these wounds is estimated to be between £507 and £530 million.
But what does it cost our patients?
For some patients, developing a pressure ulcer could mean severe pain and discomfort, an extended hospital stay and a poor quality of life once discharged.
Unfortunately, for some individuals, a pressure ulcer could result in sepsis, amputation or even death.
This is Annie. She's a 46-year-old mother of two and runs her own business at home. She's been a wheelchair user for 2 years since her multiple sclerosis became worse and recently suffered a chest infection. She felt quite unwell, so stayed in bed for a few days until she improved and started working again.
I had no idea how bad the pressure ulcer was. I have MS, so I have very little feeling in the lower half of my body. It wasn't until I felt a wet patch on my jeans and I knew there was a problem. I thought my catheter had leaked again, which isn't unusual with my muscle spasms. I didn't go and see about it for a good week when I started feeling unwell again with flu-like symptoms. My sister mentioned sepsis, so I panicked a bit. My practice nurse was horrified when she saw it, and I could smell it as soon as she took off the dressing that my sister had put on. She called the doctor in, so I knew it must have been bad. He arranged for me to go into hospital, and I wasn't very happy about that because I run my own business from home. I had orders that needed sorting, and I hate letting people down. But to be honest, I felt so poorly, I didn't have the energy to argue. As soon as I was admitted to a ward, I was started on strong antibiotics and referred to a wound specialist. We agreed a treatment plan, but this meant bed rest on a special mattress. Apparently, the bone was exposed and the doctors were worried about a bone infection. I had to stay in hospitals for several weeks being repositioned by the nurses until I was strong enough to do it for myself. I had lost weight and become surprisingly weak in the short time I had been unwell, but I suppose that chest infection didn't help either. The physios were trying to get me back to normal and the dietitians were helping me gain weight again, though I used to joke they were fattening me up. Even when I felt well, I was advised to remain in bed as much as possible, which made me a bit stir crazy as I'm always on the go at home normally. Now I'm home, my wound is so much better, but it's still not healed. I can sit up in my chair for short periods or it will just get worse again. It's hard running a business from bed, so I've had to scale down the business a lot, which of course means me and my children are having to tighten our belts. I had no idea pressure ulcers could be so life-changing. I'm vowing to be much more careful in the future. While I was in hospital, I learned about the acronym SKIN, and it's really helped me focus on what I need to do to prevent any more problems in the future.
Inspect your patient's skin within 6 hours of admission to your area and at each hygiene or repositioning opportunity thereafter. If patients are self-caring, skin should be checked at least once a day.
Make sure your patient is on a suitable support surface, reflecting their individual risk.
Patients' position should be changed regularly and documented on a skin bundle. Encourage them to move themselves as much as possible.
Keep the skin clean and dry and address any continence issues using barrier products as appropriate. Encourage a healthy diet and refer to the nutrition team if a risk is identified using the WASP score.
Our second patient has a very different story to tell. This is David. He was admitted to hospital as an emergency due to an infection. He sustained a pressure ulcer during his admission.
I ended up in intensive care where the nurses kept saying I kept kicking off my boots off my feet. That was on to try and keep the pressure off my heels. I didn't really know what was happening, but when I came around I found I had a pressure ulcer on my foot. And then whilst I was in hospital I found out that I had very bad circulation in my legs. I had blockages in the bottom of my legs, which I didn't know I had. I found out that this can increase the risk of developing pressure ulcers on my feet. And the pressure ulcer gets so painful at times. I've had it now for about 7 months. It's healing, but it's healing very slowly. Before I had this, I'd never even heard of pressure ulcers. I didn't realise at the start how a pressure ulcer could affect you. I've had a special cask and a shoe on, which I wear to keep the pressure off it.
So how do we stop this?
We can help prevent pressure ulcers by
Raising awareness to patients, their relatives and carers.
accurate pressure ulcer risk assessment, but acting on the risks identified.
Reducing the risk using timely preventative measures such as repositioning and providing the appropriate surface. This includes cushions for chairs and offloading devices for feet.
Encourage a healthy, balanced diet.
We can all help prevent pressure ulcers.
Whether at home or in hospital,
If we all work as a team, we can
stop the pressure!